Dr. Kelvin Higa doesn't have to travel around the world anymore to teach his advanced bariatric procedure to physicians. A new robotic camera gives his students across the country a whole new look, all without Dr. Higa stepping out of the OR at Fresno Heart and Surgical Hospital in Fresno.
We're providing education remotely. So traditionally what I'd have to do is get on an airplane, fly across the country or to another country, provide a lecture or live surgery, and then fly back. So even for a 1 hour, 1.5 hour session, I'll be gone from Fresno for 3, 4, 5 days, depending on how far away I have to go.
Dr. Higa is Medical Director of Fresno Heart and Surgical Hospital's Bariatric and Metabolic Surgery Program.
So what it allows is for us to provide the educational resources without time out from my practice and being away from my own patients. So it's pretty exciting technology.
The new robot looks like a parking meter with a small screen on a pole that moves up and down. The high-definition two-way communication system allows viewers to see through a laptop and control the view outside of the operative field.
Now, what's different about this as opposed to, say, two-way telephone communication is that remotely the surgeon on the other end or the conference center can control what they see. So they can see what's inside the patient, they can see what's outside, and with a joystick they can move it around and actually see what's going on. So it really is like being there without being there.
The physicians learning the procedure, who might be in South America or even Cincinnati, Ohio, can watch Dr. Higa real time and control the views, just like they were standing there with him.
I think the most important thing is that our program in this hospital is really, we're dedicated, and part of our mission is education. We not just of our own patients and follow through, but of the entire profession.
Dr. Higa says he's dedicated to being a resource.
If they have problems along the way, we act as consultants. We do second opinions, etc. And I think it really adds a lot to an institution when you provide that kind of service.
Higa says technology, like this camera, is important for his patients' quality of care.
It's about quality, efficiency, patient care, but it's also about education and research and being a resource for the people of the Central Valley, and that's who we service.